Welcome to the PMI VectorLink Podcast. While the global community responds to the COVID-19 pandemic, the vector control community continues its commitment to fighting malaria. Although this pandemic may have changed the way that we live and work, our commitment to saving lives remains as strong as ever. In this episode, we discuss the challenges of operating in this new normal and share some of the innovative practices that have allowed us to continue to deploy indoor residual spraying and insecticide-treated bed nets. With support from the U.S. President's Malaria Initiative, and by working in close collaboration with country governments, national malaria control programs, and ministries of health, we have been able to adapt our programming to adhere to social distancing guidelines and country-specific practices to continue to reduce the burden of malaria in the midst of COVID-19.
Today we're going to be discussing how the PMI VectorLink Project is continuing malaria prevention interventions during the COVID-19 pandemic. With me to discuss the topic, I have a panel of 3 people, all from the PMI VectorLink Project. We have Dr. Jen Miller, who's the Senior Technical Advisor for Insecticide-Treated Nets. We have Dr. Sarah Burnett, she's the Senior Data Analyst. And we have Dr. Josephat Shilulu, who's the Chief of Party for Uganda. And we'll dive right in. So I'll start with you, Josephat. Tell us, how has the PMI VectorLink project adapted to social distancing and to the other guidelines that have been proposed by CDC, by WHO, and by the local governments in order to continue operations safely?
The VectorLink project had to make a number of adjustments to its implementation plans. Some of these plans were discussed extensively at the national level, and subsequent to that, we had to move to the districts, where we made a lot of interactions with the district teams under the umbrella of the COVID-19 task force. So some of the key areas that were critical in ensuring conformity with the COVID-19 guidelines included the integration of IRTS under the COVID-19 response plan at the district level. We had to also make some adjustments in mobilization, in training, and also the coordination of the whole activity. So under mobilization, where we made quite a number of adjustments, we had to drop some key mobilization interventions, including the door-to-door mobilization of community dialogues and sensitization meetings. And these were taken up by the enhanced mass media, majorly the radio talk shows that were led or hosted by the district leadership under the COVID-19 task force. The project also, as one of the key approaches for ensuring mobilization, had to engage the village leaders. These are village elders who were also doubling up as the COVID-19 focal persons. With the training, again, we had to make a number of adjustments to be able to meet the guidelines set by the ministry, and these included seeking of venues that could allow sufficient distancing between our spray teams. One of the things that we had to do also was to source for extra support from other districts that were not spraying to beef up our training capacity.
Yes, thank you very much, Josephat. So yes, regarding coordination and planning, the VectorLink teams would be sitting on all the COVID adaptation committees and steering committees within the ministries and the NMCP and with other implementing partners. One way we actually very nicely helped to increase the connectivity for these meetings of the ITN focal person in the Tanzanian National Ministry, NMCP, was to actually provide for them a computer and data bundles so that they could be linked into all these meetings as well. Regarding the ITN activities, we have channel-specific context. So, for example, with the schools programs in Tanzania and Ghana, we've been working with the POR RAUJ, as they are, the Parliamentary Office, the President's Office for Regional and Local Administration, to make preparations for the letters that will show what the adaptations the schools have to make to their programs. Then with things like the health facility outlets, we've been working with the teams delivering the nets to make sure that they have the adequate PPE and that they are practicing things like spacing of the people who help to upload the nets onto the trucks and to offload them at the district and health facility levels. With the mass campaigns, we've helped with adaptations to the campaigns. For example, in Senegal, where they were going to do what's known as a two-phase operation, which would be going into the villages to register the households and then coming back again to deliver the nets. We've advised that they just do a one-phase distribution, so that's going to happen. Similarly, in Zanzibar, the usual way a mass distribution is also done is to have a fixed point. That's where everybody comes to get their nets from a central point, but often that leads to a lot of crowding. So we advise the government to actually do a door-to-door distribution so that then there'll be less opportunity for crowds to get together. So those are a couple of ways that we've been helping with the COVID pandemic activities.
Thank you so much for that very elaborate answer. What I'm hearing from both of you is that the project has successfully adapted to ensure that people are protected from malaria in a way that also ensures that the project workers and the beneficiaries are safe from COVID-19. Thank you so much. So what were some of the unforeseen challenges in operating under these guidelines, and how is the project managing those challenges? We'll start with you, Josephat.
Yeah, thank you, Alan. One of the key challenges was with regard to training, and especially for IRS, where we have quite a large number of seasonal staff to train. In some countries, we may find more than 1,000 spray teams, and in others we may get up to 4,000 spray teams, like the case for Uganda. Therefore, then the fact that we were to keep gatherings to a minimum of about 15 people, that limited our flexibility in terms of resources. So the project had to go through the use of schools, taking advantage of school closures and increasing the number of trainers at all levels to ensure that we had an effective training during this particular period. Other restrictions on numbers affected data management and data entry, where we had to source larger venues, and in some cases, even with the larger venues, we still had to have a minimum of about 10 people. And that meant that we had to delay, in some cases, our data entry mechanisms. Thank you.
Thank you. Yes, we had an interesting problem arise, an unforeseen challenge in Zanzibar during the mass campaign net delivery. And this was that at the household level, the person who's receiving the net needs to sign for it. And we found that with elderly people, they couldn't see very well where to sign in the register book. So to try and make the distance at least a meter, we got rulers so that the volunteer giving out the net could point to the place on the registry book for the more elderly people to be able to see where they should actually sign. And this is very interesting because we didn't anticipate that happening, but this learning is now going to the mainland, where the mass campaign is just starting for the delivery of over 7 million nets. So it'll be a helpful addition to that program.
Interesting. Thank you so much. I have a related question, and this is about risk management. What kind of risk management strategies are used or are you using to prevent disruption of the IRS and ITN campaigns? Josephat?
Yeah, with regard to managing risks, one of the things that the project did was to integrate IRS under the overarching COVID-19 response committee. So within that particular committee, we had a subcommittee that formed the IRS task force. And this particular committee reported to the larger task force, COVID-19 task force. In that particular way, we were assured that the districts were actually leading both interventions, the COVID response, and as well the IRS interventions. Secondly, the project went ahead to provide daily reminders and also had to conduct morning health checks to ensure that all the teams were complying, and therefore the risks of transmission of COVID was minimized. And as well as mentioned under mobilization, did quite a lot of mass media dissemination of messages, and this further enhanced our effort to mitigate any risks for the activity. Thank you.
Yeah, thank you, Josephat. So several of those things apply to the ITN activities, where we're doing adaptive management of the campaigns. As I said before, there's been instances where the double phase, if you like, has been changed to a single phase. And we're just ensuring that the VectorLink teams are at all the right meetings in order to help with these adaptations. Thank you.
Great, thank you so much. So let's shift gears a little and talk about technology. And I'll address this question to Sarah. How has the project used technology to drive progress and maintain malaria prevention gains during the pandemic?
Sure, thanks, Alan. So my work is part of VectorLink's integrated data analytics and visualization team, and our role is really to support national malaria control programs in using ITN, IRS, and other routine data sources to support program planning and evaluation. We're looking at the impact of these interventions. Normally, when we start our work, we'll start with a trip in country to meet with the NMCPs to talk about the evaluation, look at what data is available, and start developing some of those evaluation designs. Since COVID has happened, we haven't been able to take those trips, and we've moved a lot of that collaboration to online platforms. So meeting through Google Teams or Google Meets, Microsoft Teams, WebEx, Zoom, a variety of online platforms. And I think for me, one of the big realizations has been how far we've come in terms of these communication platforms. A lot of times it's the NMCPs that are setting up and facilitating these meetings using the platform of their choice. And a lot of times it can feel like two households in the same country or even the same town feel as close or as far away as two different households in different continents.
Thank you so much, Sarah, for that response. And I can also relate it to what Josephat mentioned earlier, where they had to conduct some meetings with the, with the stakeholders and some of the trainings using, tools like WebEx and Zoom. Thank you so much. What kinds of communication messages are being used during the campaigns to keep both workers and beneficiaries safe? We'll start in the field. Josephat.
The messages that we have as a project communicated relate to social distancing, and particularly so limiting of public assemblies and actually stressing to the communities, similarly with the other channels on the idea of either staying at home or keeping safe distance. Personal hygiene has also been stressed in our messaging as well, including hand washing and use of sanitizers where possible, and also the use of face masks by both beneficiaries and our spray team, and use of our PPE, full PPE for our spray teams at all times. Part of these messages also talk about symptoms of COVID and the reporting lines and measures that the field teams of beneficiaries have to take, including reporting this to health workers and to village leaders. Thank you.
Thank you so much, Joseph. And I think the overarching message that I glean from the guidelines that have come from the different areas is that malaria will still be here even after the pandemic, and that is why we are not taking our feet off the, that's why we're keeping up the pressure. So thank you so much. How is the project using data to deliver IRS and ITNs during the pandemic?
Yeah, I can respond to that.
Okay.
Despite the ongoing pandemic, the ITN and the IRS programs are still continuing, and that's good because, as you said, malaria will still be with us. And we're continuing to support countries in using data to support their program delivery. So in Zambia, for example, we're working with other partners to incorporate the use of geospatial data in really targeting their ITN and IRS interventions. And we're also working with Zambia's National Elimination Program to develop data collection systems that allow for a more granular review of that ITN and IRS data down to that sub-facility level. So they can really track their program coverage, which I feel like is even more important in the midst of this pandemic.
Thank you so much, Sarah. And for the campaigns that are running, what is the data showing? Is the project protecting the number of people it set out to protect during the pandemic?
Well, yes, Alan, I'm really thrilled to say that, for example, the campaign I've just mentioned in Zanzibar, almost 200,000 nets were given out in just under 10 days. And that means now that at least 400,000 Zanzibaris are being protected from malaria. Since COVID started in Tanzania, we've distributed over 860,000 nets to women and children attending the ANC clinics, pregnant women, and the children who get at 9 months their MR1, measles rubella vaccination. So that means that, of course, mum, dad, and baby share a net. And other siblings may too. So that will mean that over 2 million Tanzanians now being protected. Our schools program will be ongoing in both Ghana and Tanzania, starting in July, towards the end of July, August in Tanzania, and September in Ghana. And combined over 3.4 million nets will be given out. Again, where siblings will share or other household members, over 5 million more people will be protected from malaria.
Yeah, similarly to with regard to IRS, despite the apprehensions and the fears that everybody had at the beginning as we entered the period of March or February, March, it is interesting to note that the implementation of IRS has progressed so well, and the project has been able to meet its targets and in some cases actually surpassed. And this is because of the great collaboration and coordination that has been put in place during this particular time.
I think it's really encouraging to hear how the ITN and IRS campaigns are able to maintain those high levels or even surpass those high levels of coverage that we've had in previous years. But I think we'll only really know about the impact of these campaigns when we start seeing that malaria case incidence data that comes out in the months following these interventions. And through the VectorLink program, we're going to be doing evaluations in 6 different countries using that routine malaria data. So hopefully we'll be able to look at that and try to assess the impact of these interventions on malaria case incidence. However, there is a risk in the times of COVID in the sense that the data coming into health facilities may be different, may not be the same. And with that, we've been using the WHO's Rollback Malaria Monitoring and Evaluation Reference Group guide that they developed called Monitoring and Evaluation of Malaria-Related Routine Data During the COVID Pandemic. And this guide is really designed to help countries use their malaria data and monitor their malaria cases during COVID. It recommends, for example, monitoring the number of outpatients at a health facility. If there's a stay-at-home order, you could see that the outpatients might decrease, or if people are afraid of coming to the clinic due to COVID. And if you see that, you might also see a commensurate drop in malaria cases. Now, that's not a true malaria case decrease. It's really just people aren't coming to the health facility to get tested. So as we're doing our evaluations, we'll be using this guide. We'll be looking at this data really in depth to kind of tease out what the impacts of these interventions are during the COVID pandemic.
Great. It will be interesting to see those results. And thank you so much. Looking ahead, what changes do you see that have been made in malaria prevention interventions during this period, during the pandemic, that will continue after it is no longer a global crisis?
Thank you, Alan. That's a very interesting question. As I've mentioned before, we have seen some adaptations to the way that mass campaigns have been carried out to try and minimize the risk of crowding at a fixed point place for people to get their nets. There's been a move to the door-to-door distributions. There's also been a move to doing a single phase instead of doing the registration first and then following up by distributing the nets, just to register and just distribute. With that, you do need to have good household data to start with from a fairly recent household census or other data, but it is actually also been seen as more efficient and less costly to be able to just go and do the household registration and the delivery of the nets in one stage rather than going around. You can imagine a country the size of Tanzania doing the registration and then going back to do the distribution it takes a long time and is very costly. So there may be after the pandemic this move to sort of a one-touch base for some of the activities such as mass campaigns. Thank you.
Thank you so much, Jen. I think we have come to the end of our conversation. I would like to thank all the panelists for sharing their experiences and their insights. It is good to see that we have been able, as a project, as a PMI VectorLink project, we have been able to protect people from malaria as planned, despite the challenges that have been brought on by the pandemic. And it's taken a lot of collaboration, innovation, and agility. Thank you so much, everybody.